Hi, my name is Nito. This is Bio 230 Anatomy and Physiology. Today's video is going to be axial and appendicular skeleton. Today is April 7, 2024. I have anything back here. The human skeleton is divided into two main parts, axial and appendicular skeleton. The axial consists of 80 bones and consists of the skull, the vertebrae column, the ribs, and the sternum. The appendicular skeleton consists of the upper and outer and lower limbs. And they consist of 126 bones, also as well as the bones that and limbs that connects to the axial skeleton. Here we have the frontal, the lacrimal, the zygomatic, the mandible, maxilla, the vomer, the nasal, the ethmoid, and the sphenoid. Here we have that was the anterior view of the skull. This is the posterior. This is the parietal, the occipital, the temporal, and the mandible. This is the lateral view. This is the frontal, the ethmoid, the lacrimal, the nasal, the zygomatic, the maxilla, the mandible, the occipital, the temporal, and the parietal. Here we have the inferior view. This is the parietal, occipital, temporal, sphenoid, and the frontal. Here is the vertebrae. Here is the C1 to C7 is the cervical. T1 to 12 is the thoracic, L1 to L5 is the lumbar, sacrum, coccyx, C1 is the atlas, and C2 is the axis. Here we have the thoracic. Rib 1 to 7 is the true ribs, and from rib 8 to 12 is the false ribs. 11, 12 is consider the floating ribs. Here is the sternum. Here is the manubrium, and here is the body of the sternum. Here we have the upper and lower limbs, and pectoral and pelvic girdle. Here we have the clavicle, scapula, the humerus, the ulna, the radial, the metacarpal, phalanges, femur, patella, tibia, fibula, the ilium here, the ischium, and the pelvic bone here. Here we have the hand and the wrist. This is the phalanges. Here is the carpal. This is the trapezium, trapezium, trapezoid, and scaphoid. Metacarpal. Here we have the hamate, capitate, pisiform, triquantrum, and the lunate. And here we have the sesamoid. Here we have the ankle and the foot, tarsal, metatarsal, phalange, cuboid, calcaneus, the talus, the navicular, medial cuneiform, and the intermediate cuneiform. And the bone disease I chose is osteoporosis, which is a bone disease characterized by decreased bone density, structural deteriorating bone tissue, which is a risk, increased risk for fractures, This happened in older adults, especially women in their menopause. Also, but it also affects men. Structural changes that occur is the thinning in the trabecular bone, increased bone porosity, loss of bone microarchitecture, functions that changes would be increased risk of fracture, decreased mobility, and functional physical function. Also height loss and spinal deformity and compromised bone healing. Thank you for watching.